Sarah, a lively 55-year-old, felt a sudden flutter in her chest one evening. It felt strange, like her heart was skipping a beat. She dismissed it as stress, but the feeling returned, stronger this time, accompanied by dizziness. Fear creeping in, Sarah rushed to the hospital. After a battery of tests, including an electrocardiogram or ECG, the doctor diagnosed her with Torsades de Pointe, a rare heart rhythm disorder. An ECG is a simple test that measures the heart's electrical activity, and in Sarah's case, it showed an unusual twisting of the points pattern, a telltale sign of Torsades. The doctor inquired about Sarah's medications, particularly any antibiotics she was taking. Sarah had been on a new antibiotic for a week. The doctor explained that this particular antibiotic was known to prolong the QT interval, making the heart vulnerable to this specific arrhythmia. The QT interval, visible on an ECG, represents the time it takes for the heart's ventricles to contract and relax. Certain drugs can extend this interval, increasing the risk of Torsades de Pointe, a potentially life-threatening condition. Torsades de Pointe is a rare but serious ventricular tachycardia, meaning the heart's lower chambers beat abnormally fast. This chaotic rhythm can disrupt the heart's ability to pump blood effectively, leading to a range of symptoms. Patients may experience palpitations, dizziness, lightheadedness, or even fainting. In severe cases, Torsades de Pointe can lead to cardiac arrest, a life-threatening event where the heart stops beating effectively. Diagnosis typically involves an ECG, which reveals the characteristic twisting of the points pattern. The doctor will also review the patient's medical history, medications, and electrolyte levels, as imbalances can contribute to this condition. Prompt diagnosis and treatment are crucial to prevent complications. Treatment often involves medications to stabilize the heart rhythm and address any underlying electrolyte imbalances. Several medications can prolong the QT interval and increase the risk of Torsades de Pointe. These include certain antibiotics, antifungals, antipsychotics, and even some over-the-counter medications. Among antibiotics, macrolides like erythromycin and fluoroquinolones like ciprofloxacin are known culprits. Antifungal medications like fluconazole and ketoconazole can also pose a risk. Certain antipsychotic medications, such as haloperidol and ziprasidone, have been linked to QT prolongation and Torsades de Pointe. Additionally, some antidepressants and antiemetics can also increase the risk. It's important to note that not everyone taking these medications will develop Torsades de Pointe. The risk varies depending on individual factors like genetics, electrolyte levels, and other underlying health conditions. Section 4. Aspirin and Torsades. A case of mistaken identity. While many medications carry a risk of QT prolongation, it's important to differentiate between true culprits and those wrongly accused. Aspirin, a common over-the-counter pain reliever, often falls into the latter category. Aspirin is not known to prolong the QT interval or cause Torsades de Pointe. In fact, aspirin is often prescribed to patients with heart conditions to prevent blood clots. Confusing aspirin with other medications that can cause QT prolongation can have serious consequences. Patients might unnecessarily avoid taking aspirin, depriving themselves of its beneficial effects. It's crucial to consult with a healthcare professional to understand the potential side effects of any medication, including over-the-counter drugs, and avoid self-medicating. Section 5. Your health, your right understanding medication effects. Sarah's story highlights the importance of understanding the potential side effects of medications, even those prescribed by a doctor. While medications play a vital role in managing various health conditions, they can also have unintended consequences. Patients have the right to be informed about the risks and benefits of any medication they are prescribed. Don't hesitate to ask your doctor or pharmacist about potential side effects, drug interactions, and any precautions you should take. Being an active participant in your healthcare involves staying informed about your medications, understanding how they work, their potential side effects, and when to seek medical attention can empower you to make informed decisions about your health. Remember, knowledge is power, especially when it comes to your health. By staying informed and communicating openly with your healthcare providers, you can minimize risks and prioritize your well-being.